Preparing to live stream. All right. Well, hello viewers. Thanks for tuning in to our Facebook Live today. My name is Rachel. I'm a health promoter in family health here at Niagara Region Public Health, and I'll be hosting today's live event. Today we'll be talking about the COVID-19 vaccine and pregnancy, breastfeeding, fertility, and other reproductive health concerns. I have with me here Amanda Hicks, registered nurse and reproductive and child health manager at Niagara Region Public Health, and Ellen Stevens, registered nurse with our home visiting program and lactation consultant. Amanda, could you tell me a little bit about your professional background and current position?
Sure, I'd love to. Thanks, Rachel. So I've been a registered nurse since 2002 and worked in labor and delivery at the old St. Catharines General Hospital when I started my nursing career. I've been in public health for many years now, in several programs in our family health division, including Healthy Babies, Healthy Children, our school health program, and now a manager in our reproductive and child health program, where we offer a number of supports to families in Niagara, including breastfeeding outreach, prenatal programming, and several parenting programs. I also sometimes teach at Brock University in the School of Nursing, particularly the care of the young family course.
Amazing, thank you. And Ellen, could you also tell me a bit about your professional background and current position?
Hi, everybody. My name is Ellen. I am a public health nurse here at the region. I'm fortunate enough, actually, this is my 10th year of nursing, and I absolutely love it. Over the course of my 10 years, I've always worked with moms and children and young babies, and I'm currently in a program now home visiting young first-time moms and supporting them in their parenting journey. I also do some clinical instructing with Brock University in their nursing program, and I continue to pick up shifts in the St. Catharines Hospital in the NICU.
Amazing. Thank you both for being with us. We're fortunate to have two healthcare professionals here to talk about these issues today. So all the information in today's Facebook Live is taken from credible evidence-based sources, and they will be linked in the comments of the live stream for you to access as well. So let's start off with an important question. Is the COVID-19 vaccine available for pregnant or breastfeeding people? Ellen, I'll start with you.
Absolutely it is. So the COVID-19 vaccine, it's available for all pregnant and breastfeeding individuals. Pregnant individuals are unfortunately at an increased risk of serious illness or death should they become sick with COVID-19. The COVID-19 vaccine can be given at any time during pregnancy. And should you require another vaccine during pregnancy, so for example, the flu shot, tetanus, it's recommended that you receive your COVID-19 vaccine 14 days following that.
Okay, awesome. So next question, there's been some misinformation shared widely online about the COVID-19 vaccine and fertility. So Amanda and Ellen, can the COVID-19 vaccine impact a person's fertility?
So thanks for this great question, Rachel. This started as an internet rumor and has unfortunately taken off. Some people have made false claims that the COVID-19 vaccine makes your body attack its reproductive organs, leading to infertility. There's no scientific evidence or truth behind this concern that vaccines somehow interfere with fertility, regardless of your gender. There is also no evidence that people have problems getting pregnant after getting the COVID-19 vaccine. In fact, during the vaccine trials, about the same number of people got pregnant in both the placebo and vaccine groups. Some people who voice the concern speak of fertility research around this vaccine. No such research exists. This is all driven by misinformation on the internet.
So something else to consider as well is that vaccines, they stimulate an immune response. So the particular protein or antigen of that virus bacteria, that is what our immune system is working towards. So in this case of the COVID-19 vaccine, it is stimulating both an antibody response and a cell-mediated immune response against the spike protein of the SARS-CoV-2 virus or COVID-19. There's no way in which they could affect or interfere with the functioning of the reproductive organs in either men or in women. The proteins used for implanting in the placenta and the spike protein have similar amino acids, but however, they do remain different. The antibodies that are produced against the COVID-19 spike protein will not block or interfere with the implantation of the placenta. Our bodies are smart, and the vaccine will train your immune system to focus their attack on the coronavirus without attacking your internal organs. People can also rest assured that these vaccines will in no way interfere with fertility.
Okay, well, that's great to hear. Thank you both for that answer. So our next question is, should a person who is pregnant get the COVID-19 vaccine? Is it safe?
Okay, so all pregnant individuals and their partners are eligible and recommended to be vaccinated as soon as possible and at any stage of their pregnancy. Vaccination can be considered at any gestational age, including during the first trimester. All available vaccines that are approved in Canada, including the AstraZeneca vaccine, can be safely used in any trimester of pregnancy or while during breastfeeding or chest feeding. Pregnant individuals are at an increased risk of serious illness or death from COVID-19 infection. Pregnant individuals are at an increased risk for hospitalization, ICU admission, mechanical ventilation, and death compared to non-pregnant individuals that are infected with COVID-19. Pregnant individuals who have COVID-19 are also at a higher risk of delivering prematurely. Given the potential risks of COVID-19 in pregnancy, the benefits of vaccination far outweigh any risks.
Yeah, and thankfully, further trials and research are always ongoing and tell us more every day about vaccine safety. Recently published preliminary analyses of over 35,000 pregnant individuals in the United States who received a COVID-19 vaccine like Pfizer or Moderna did not reveal any safety concerns. A recent Northwestern medicine study of placentas from patients who received COVID-19 vaccine during pregnancy found no evidence of injury, adding to the growing literature supporting the safety of COVID-19 vaccination in pregnancy. And actually, research provides evidence that pregnant individuals can transfer SARS-CoV-2 antibodies to their fetus based on antibodies detected in the umbilical cord blood, which may provide some additional protection to the infant. If you have any further questions, it's important to speak with your healthcare provider as soon as possible about getting the COVID-19 vaccine while pregnant.
That's wonderful. Thank you both. So what if a person is planning to be pregnant? Should they delay the pregnancy or the vaccine?
All individuals who plan to conceive should be offered the COVID-19 vaccine. There's no reason to delay vaccination or pregnancy. And ideally, an individual would be fully immunized against COVID-19 ahead of pregnancy to benefit from maximum vaccine protection throughout the entire pregnancy and minimize the risks of COVID-19 infection.
That's great. All right, so our next question is, should a person who is breastfeeding or chest feeding get the COVID-19 vaccine?
Thanks so much, Rachel. So the vaccine is safe for breastfeeding or chest feeding individuals. People who are breastfeeding or chest feeding should be offered the COVID-19 vaccine. None of the approved vaccines currently contain any live virus, so there's no risk of that virus passing through breast milk to baby. Recent preliminary data, on the other hand, as well, reveals that there's no safety concerns at this time, and that mRNA from the vaccines do not transfer into breast milk. In fact, and interestingly enough, anti-COVID-19 antibodies produced by the breastfeeding person have been shown to transfer through the breast milk and provide protection to the infant, which is wonderful. There isn't enough evidence at this time that receiving the vaccine can impact milk supply. But if you do have any concerns regarding your milk supply, please feel free to reach out and connect with us at Niagara Parents.
That's great, Ellen. Thanks. So do pregnant people have different side effects from the COVID-19 vaccine?
So as you know, there have been several vaccines administered worldwide at this point, and what we've seen is there's no evidence suggesting increased side effects in pregnant individuals from the COVID-19 vaccine. Side effects from the COVID-19 vaccine can include sore arm, headache, fatigue, and general feeling of unwell for a couple of days, regardless of whether you're pregnant or not.
Makes sense. Thanks, Amanda. So we've been hearing that some people have concerns about the COVID-19 vaccine and menstruation. Can the COVID-19 vaccine impact menstruation?
So menstruation itself is a really complex process that can be affected by many, many different things. Did you know that the lining of the uterus is actually considered an active part of the immune system? So to me, this was really interesting information. And because of this, the COVID-19 vaccine stimulates the immune system. It's possible that there may be some changes to your menstrual cycle. It's also true to consider that environmental factors, including stress, a change in your sleep habits, and medication use can also impact menstruation. You can definitely receive the COVID-19 vaccine while on your period, and there's no need to reschedule until following that.
Okay, that's great, Ellen. Thank you. Another question is, can the COVID-19 vaccine impact the effectiveness of birth control?
It's a good question, Rachel. And to date, there have been no known interactions between contraceptives or birth control and the COVID-19 vaccine. Of course, if anyone is concerned about the effectiveness of their contraceptive for any reason, should speak with their healthcare provider about whether or not to use a backup method or find an alternative contraceptive.
That's great. Thanks, Amanda. And our last question for today is, where can a person go to find credible information about the vaccine in pregnancy, breastfeeding, or fertility?
Thanks, Rachel. This is such an important piece. So it's always recommended to view health information from credible sources. In Canada, some of these sources may include the Society of Obstetricians and Gynecologists of Canada, Health Canada, the Public Health Agency of Canada, Public Health Ontario, and of course your local health department and healthcare providers, just to name a few. We will be linking today's sources for more information in the comments, so please feel free to review those as well.
Absolutely. All right, so those are all the questions we have for today. Viewers, if you have any additional questions or would like to learn about other resources to support a healthy pregnancy and birth, please connect with us at Niagara Parents by sending us a Facebook message or visiting niagararegion.ca/parents. Thanks for watching.
Thanks so much, everybody.